Welcome to Beneath the Branches, the podcast for the Adoption and Foster Care Clinic where we sit in the shade of shared experience. The heart is normalized and belonging is built one honest conversation at a time. Adoption, foster care, or kinship placement brings deep joy and real challenges, and we're here to talk about all of it. The hard, the heartwarming, and everything in between. So grab a cup of coffee, take a deep breath, and join us as we hold space for the messy, beautiful work of building connection beneath the branches.
Welcome to Beneath the Branches, a podcast of the Adoption and Foster Care Clinic. I'm Dr. Jennifer Chambers, joined here with me with Caitlin Inman and Kelly Curry. We hope that this podcast will be a place that that families can join together to feel safe, and we can be very real and share stories and just journey along the way with you guys here beneath the branches. Why don't we introduce ourselves first? Caitlin, you want to go first?
Yeah, I'm Caitlin. My role at the clinic is child and family therapist.
Yes, sounds good. Caitlin Inman. All right, Kelly?
I'm Kelly Curry, and I am the Director of Clinical Services, or Therapeutic Services here at the clinic.
Okay, and then there's something that's very unique about both of you guys that you bring to the table.
Mm-hmm. Yeah, I'm a domestic adoptee in reunion.
Uh-huh.
Mm-hmm.
And what does in reunion mean?
In reunion means that I have identified or connected with my birth family.
Okay, yes. And Kelly?
And I'm an intercountry adoptee, also in reunion from South Korea.
Awesome. And I'm Dr. Jennifer Chambers. I'm adoptive mom of 3. And I founded the original adoption clinic at UAB and Children's Hospital. So our clinic is new. We've been open just since September of 2024. Why don't we talk a little bit about why we started the clinic and kind of our history of the clinic as well.
Yeah. Well, why don't you share about, because I love the story about why you started the original clinic.
Yes. So the original clinic was started, I was trying to see these patients that were internationally adopted at that time, and like as a regular private pediatrician during my residency time, I would see them in our primary care clinic. And I was always kind of getting in trouble for going too long, because these kids just, they need a lot of full investigation of all areas, both medically, emotionally, developmentally. And so I realized, gosh, this will never work in primary care to really do what I felt like these kids really needed in order to support them and their families. And so that's why we started it, just to, we wrote a grant to get the original clinic started, and it allows us more time to dig deep. So we don't do any of the primary care stuff. We don't do the vaccines. We don't know colds and coughs typically. We just do anything that's related to their international, domestic adoption, or foster care, kinship care. And which is why it's been so great to have a whole team, because I feel like I've learned so much from you guys. We have you two as therapists, and then we also have Karen Belcher, who's my co-founder here at the clinic, who helps me with all things nursing and clinical setup. And then we have Amy Elmore, who's our developmental specialist. And we'll hear from Amy on other podcasts as well, because she wears multiple hats. She's been with me in the clinic for 21 years. So she also has specialty training in sensory processing and also feeding therapy, which is, both of those are greatly needed for our kiddos. So it's been really nice. It's nice to have this full group of clinicians in order to see one child through multiple lenses.
And I love that you saw that at the very beginning. At the very beginning, when you began seeing adoptees, you realized that adoptees are just multifaceted. There's a lot of areas that you need support, and you can't do that standing alone, like with just like the medical information. And so you started it with a developmental specialist and a child and family therapist, and that has just kind of continued because it works. Like I think that's the magic of the clinic, is that we're a team. We're an interdisciplinary team. We're able to see more of the whole child. So I love that.
Yeah, I think it works much more. We can get to the answers of what could possibly help a child in a more cohesive and deeper way. Definitely. And I think that there's a lot of trust amongst us as staff as well. Kelly was with us at the other adoption clinic as well. And Caitlin's been working with Kelly for several years as well. So, and then Karen and I were together at Children's for many, many years. So there's a lot of trust and a lot of just respect for one another that really helps us dig deeper for families and help families in a more all-encompassing way. Yeah. Because sometimes the stories are hard, and we kind of need each other to get through the hard of some of our families, their children's past stories. And one of the reasons why it's so important for us to start the podcast and even just start the clinic as well is just the need that's out there that we as adoptive moms and adoptees see in our own community. There's just a lot of times where we feel alone, and we want others alongside of us. I mean, I had the great benefit of adopting my 3 children while being part of the clinic. I had no children when we started the clinic. So those three, I was able to, just pick you guys' brain and kind of go along that journey together. Because, I'm a pastor's wife. And so I get a lot of support, from our church. And, but I still felt very alone because nobody understood my journey that I was on. And so it's been really important for me to help kind of create that community where people can understand that journey and also help other people like churches understand what that journey is.
And you also started the clinic with other moms who were also adopting, right?
Yeah. And then
which is so fun.
We just experimented on our own children to see what worked. And that's kind of how we created what our service lines too, is like, what do our kids need? What do we wish existed for our children? There's no better way to start anything than to be a desperate mom.
Right.
So definitely. And then too, like now that our kids are older and we have you guys' opinion, we can also kind of craft services based on what we think collectively that our families need.
I think, and Caitlin may agree with this, I think that's one of the big draws for me to the clinic is, I was one of these kids. Like my family was one of these families, and I just think about like how helpful it would have been had my family been able to benefit from something like the clinic, but instead, like they had to piece together different services to kind of figure out me, and like my needs. And so just to be able to come to one place with providers who like really got it, who really understood what you're going through, the joys and challenges, I think that would have been really powerful for them.
Yeah, one of my daughters is always telling me that because she has a lot of friends that she's met now that she's left the house that may not have had that support due to adoptees that hadn't. And she's like, how come these people don't have that support? So it's really been nice to say, well, we're creating it. We're going to create it.
So do we want to talk through maybe some of the services that we offer, pre-adoption and post-adoption?
Yeah, let's do that.
Okay.
Let's do that. Maybe we'll start with pre-adoption.
Okay, that sounds great.
Because that's my favorite. So pre-adoption, we do pre-adoption education through seminars, and also we do pre-adoption evaluations. So like when a family gets a file of a child and they're considering adopting or fostering, then we can go through that file with them and just see if there's any special needs, be it medical or be it emotional. Like maybe they've had a lot of moves, maybe they're an older child, maybe they have some hard diagnoses. Then we can do that via telephone is how we usually do it, because that service we offer to anyone in the U.S. and the world, because
Abroad,
we
yeah.
have some families from abroad that take advantage of that service because you can do it, all electronically, and then there's not that many people that offer that service. So then that's just a joy for me to walk through that step with families, because it's a very scary yes or no, when
Right.
you're making that decision, and
Right.
it's good to have a non-biased person
Right.
who's able to walk you through that.
Yeah.
For sure.
And I think even so, we do offer pre-adoption education, and even like some parent work, if that's needed before. But then there's that special needs checklist, the dreaded special needs checklist that so many families have to fill out as they're starting their adoption process. And I know that can really be overwhelming and daunting to families. So Dr. Chambers is available. A lot of families come to her to be able to kind of walk through that checklist with them, right? You kind of go over.
Yeah, and it just cuts down also the angst and the time it takes for families to do it. There's a lot of angst and unless you're a medical provider, you don't really know what half the stuff is on the list. So we're able to spend an hour, go deep into kind of what the family feels like they can handle, and then look at the medical special needs to see if there's ones on the list that particularly might fit with them, or ones they don't understand that I can explain.
Right. And kind of the outlook too, right?
Yeah.
Like, if they're going to adopt this child with this special need, like what they may need post-adoption.
Right. Yeah. As far as subspecialists or counseling services or therapy services like OT, PT, speech. And then what kind of questions you need to ask your insurance company before you make this decision, to make sure you're not creating a financial burden for your family that's too great.
Right.
Yeah.
I think that's really helpful.
And then we do like the on-call services while people are traveling, either domestically or internationally, so that they can call us with medical or emotional needs while they travel. So those are really fun as well, because I remember being in China scared to death.
Yeah.
You know what I mean? So when I called one of our early moms to help me start the clinic, so
yeah. And then post-adoption, we offer what's called our initial consultations or initial evaluations. And we generally conduct those really soon after a child is placed in the home. And for any child who walks through our door, we really recommend that child be fully assessed by each of our specialists in clinic. Because again, we work as a team. I think that's the magic of the clinic. Because our kids are more than just one domain. It takes all of us to kind of figure out the pieces to our kiddos. And so for every initial consultation, the child will be assessed by a child and family therapist, our development specialist, and of course, Dr. Chambers. And then we will all together create a treatment plan along with parents and guardians. So that's our initial consultation. And then we have something called an interdisciplinary consultation. And generally, that service is used for kiddos who've been home for a while. And maybe there's like a challenge. There's a challenge in school. There's a behavioral or emotional challenge. It could even be like a medical challenge that there's, parents are not sure of or have questions about. But same thing, we really recommend that kids be assessed by all of us. And we kind of do the same thing, assessment by child and family therapist, development specialist, and then Dr. Chambers. And then we work as a team. We come together really like team and talk about that child's needs, what we feel like that child needs resource-wise. And then we partner with a family to get that done. Whether that is, treatment here, like ongoing OT treatment or ongoing feeding therapy or sensory therapy or counseling with Caitlin or I, and or medication management. And then we follow all of our clients really closely. Our kind of motto is, once you come in your family, you're always family. And we follow all of our clients really, really closely, which I think families really love. I think families feel a part of it. And so that's primarily our clinic services. And then, of course, we have kind of outlying services. Amy Elmore does ongoing sensory work, feeding therapy, traditional OT. And then Caitlin and I do counseling. Did I miss anything? Are there any other services? I think I hit them all, right? Yeah.
Yeah. What about the different types of counseling? Caitlin, you want to touch on that?
Sure, yeah. Kelly and I do have some overlap in trainings and things that we do. I tend to typically work with our younger kiddos, and sometimes older kiddos through a modality called TheraPlay. And then also, and that's like attachment, regulation, trust building type therapy with child and parent in session together. And it also has an element of parent coaching, which is really important because, once a week in the office is not enough to like really transform create what a child needs and transform a relationship or an environment. So the parent coaching piece allows us to support parents and kind of transfer over what we're working on in TheraPlay sessions to home, which is really great. And then we'll do some ERP work too, which is exposure response prevention, commonly used with like high anxiety or OCD, some EMDR, which I don't need to define all these, eye movement, reprocessing, desensitization, which is really good for like specific traumatic events or even just like things that people feel hung up on or stuck in. There's like different ways that you can utilize it to work through different things. What else?
I mean, we've had training in DDP, some IFS, of course,
emotionally
TFCBT.
focused family therapy.
Which I like that you're able to like use those skills and say, okay, let's see which therapy modality will work for this family.
Right.
Sometimes
You're
it's
not
like
stuck to one.
we like take a little bit from a lot of things depending on like what they need, what the family needs.
And generally that's the case. Like we don't use just one. You've got to pull from a lot of different modalities to be able, even like art and narrative, especially when working with kids.
I think with our population too, we both rely heavily on attachment, trauma informed. Like knowledge that comes from just multiple sources of training and education and just experience that we've acquired through years of work and bringing those things into the services we provide.
And they're all TBR practitioners as well.
And that's kind of the foundation for everything. So like TBRI is kind of the foundation for all of the work that we do in clinic, I don't think that you can operate working with a population that we do without having that foundation. It's super important.
I think it definitely influenced how we modeled the whole clinic. From the space of having our clinic on a cul-de-sac, so it's less stressful, and one level, so kids can just get right out of the car and come right in to having a living room and a playroom rather than a waiting room, having therapy dogs to help calm, plenty of snacks and drinks, and a hostess volunteer, just things that make a family come in and feel relaxed and like they can just hang here and not think I'm at a doctor's office, which most of them don't even think they're at a doctor's office. Sometimes they go, no, I have to examine you. But you know what I like too about y'all's therapy and being here in the same space is that even if you're a therapy patient, like you don't have to share with me anything confidential, but we can run things by each other. So if I'm treating a child medically, and you're treating the same child in therapy, I feel like we can be synergistic in our treatment, and it's much more effective that way because you guys give me pieces of information that I need in order to do something like make a decision whether a child should be on ADHD meds or anxiety meds or need sensory integration work, which has been helpful for me. I mean, I think if I ever had to go just private pediatrics, I would just feel so insecure about making a diagnosis because here I have so many ways to rule other things out so that when I finally make a diagnosis and decide to start meds on a child with ADHD or anxiety, for example, I feel very confident that we've done all the underlying work and this is our option that's the most helpful at this point. So that's a real big benefit that I feel having you guys here.
And then families don't have to go to 2 or 3 different places. They can come to one place and get it all done. Because that's hard for kids, especially kids who've experienced trauma and transitions and all of those things. So I think that's a real benefit.
Yeah, I do too. And they get used to being here.
They love it.
Oh my gosh,
they get real comfy.
Yes.
Sweet.
I like too that people feel, that we see kids over their lifespan,
Yeah.
right? So I've noticed, because I'm getting to see the kids that are coming into therapy for you guys, kids that I treated when they were 2 are now 20, and they're still doing some adoption identity work, because your adoption identity isn't formed in one day.
Right.
It's
Right.
formed over a lifespan, just like the rest of our human development is. And so that's always been a treat for me to get to see all the young patients coming in through different points of their life to clinic.
And that's so fun for me too, like seeing patients that we originally saw
Yeah.
at the International Adoption Clinic at the time. And, now they're 14, 15, 16, 20, and get to see them now. That's so fun.
And helping them launch, because it's hard. It can be hard to launch.
Yeah.
To college or to trade school or to job. It can be hard to launch. So that's fun to help them and come alongside them for that.
Yeah.
Definitely. I think the most joyful aspect of this clinic is hearing people say, I've never been to a place that really understands like you guys do. Like that is very fulfilling, because that's our main purpose, is to help people not feel alone. And it will be too on this podcast, is, we can't see every person in clinic, but the podcast could help us reach a larger population of families like ours. Maybe we could talk about some of the topics that we're going to cover on the podcast.
Well, and I think, a lot of our topics are going to be centered around, like, what are the most common needs we see? Like, what are the tricky behaviors? Why do people present to clinic? So I think school issues, like trouble with school, is one. And then, of course, like just dysregulation, kids who are having trouble regulating, and, what's the core need behind their behaviors, because it could be a wide variety of things. And so we're here to kind of help tease that out. So I think that's a couple of things that we see a lot of.
Attachment needs is a big one.
Yeah. Anxiety.
Yeah. Identity.
Yeah. We'll do a podcast on special events like Mother's Day and Family Day and birthdays, because those can be hard for our kiddos and for the parents, definitely.
Yeah.
I'll do some interviewing of Amy Elmore to look at what are some tips and tricks developmentally, what are reasons to bring your kid or be concerned. That'll be helpful. And then we'll have guests as well. Just kind of as we get feedback from you guys listening, we'll know which guests we need to have, whether it's subspecialists in the medical field, birth mothers, any kind of guests that we hear that people listen to the podcast want to hear, then we can also do that as well.
I know we're really excited about doing, it may be a couple of podcasts on just reunion, the search and reunion process. And that's going to be a fun one.
Yeah.
And then like school, accommodations, testing, traveling and vacations. Like there's just so many things that we can hit on, as we continue. Sleep. Oh, that's
a favorite topic.
Eating.
Yeah. Adoption identity formation.
Yeah.
That's another great one that we'll hope to get to as well.
And I'll be really excited to see like just feedback from people who are listening. Like what other topics do people want to hear about, and that can kind of help inform like where we go next.
So we just invite you to follow along with us. Give us feedback. We've never done a podcast before.
Oh my gosh, no.
But we talk about this stuff ad nauseum every single day and at night with our kids and our families. So we just want to be a resource. So families, we named it Beneath the Branches, because Beneath the Branches is just kind of a safe place, a place of shelter, a place of community and rest. And that's what we want it to be for ourselves, our families, and your families as well. So feel free to follow along and give us feedback.
Thank you for joining the Adoption and Foster Care Clinic for another episode of Beneath the Branches, a podcast for adoptive, foster, and kinship care families. We are deeply grateful to our sponsor, Show Hope, for their generous support and their continued work to break down barriers to adoption and support families every step of the way. Until next time, may you feel covered, connected, and never alone beneath the branches.